Okay. So now for our two fabulous facilitators, Cosi Velioso. Cosi is a master's in physical therapy. She's been in clinical practice for 17 years. And she also has her own private practice in Florida, where she specializes in individuals with limb loss. She also has a fantastic show. It's a live Facebook show, Wednesday nights, 8 p.m. Eastern. Cosi Talks Live. Check it out. It is dedicated to the limb loss community. She has manufacturers and amazing guests on, and it's a wealth of knowledge. So check her out on Wednesday nights. Thank you for being here, Cosi.
Oh, my pleasure. Thank you for having me.
And Greg Mannino, where'd you go?
Greg? He's hiding from us.
Greg, where'd you go?
I finally scared him off.
Yeah. Well, we're going to give Greg a second to come back, but meanwhile, I will tout his accolades. Greg has been in the prosthetic industry for over 20 years. He's worked with manufacturers for them, as well as consulting on new technology. He's also a certified practitioner for over 10 years. He is a 22-time world champion, Olympic, Paralympic, Alpine downhill skier as well. And Greg, I hope you're okay with me sharing. He's also a Trans-Femoral Amputee himself. So a lot of experience in that realm as well. So on that, I'm going to hand it over, I think, or not, to Greg and Cosi.
Yes, it's like, oh wait.
So Cosi, why don't we get started? We're going to chat a little bit about the importance of hygiene and skin and then we'll delve into the topic of the roles of the practitioner and the prosthetist.
Absolutely. And guys, thank you so much for having me here again this evening. I really love doing these talks. I think education is just so important when you've been through any kind of health crisis, especially through limb loss. And I recognize some of the names on our guest list this evening. I know they've been on my show. So guys, thank you so much for coming on board, and we welcome you. And any of you who've watched my show, you know I love interaction. So start putting those questions into the chat section and let us know what your questions are. So as Chris mentioned, we're going to talk a little bit about the importance of skin, and then we're going to dive into the role of the physical therapist and the prosthetist. And I can't wait for Greg to get back on board, because he really is such an amazing clinician, and it's really wonderful to learn from him. And also just to, for everyone to see, you know, what the team can look like. So, you know, if you've seen my show, you know that there's a lot of things, a lot of soapboxes that I get on. And one of the biggest ones is skin health, because it all starts with your skin. If your skin is not healthy, if it is not in good shape, you've got nowhere to go. And shortly after that comes what is on your skin, between your liner and the fit of your socket, okay? Skin is number 1, liner, socket 2, and 3. If those 3 things are not lined up, doesn't matter what kind of a fancy foot, knee, bionic system you have on, you're not going to be getting anywhere. So one of the reasons why I was so excited to work with VitalFit is, for the past 17 years that I've been practicing, I had nothing that I could recommend to my patients. It was basically, okay, go to the Walgreens or the CVS, and Greg recommended Bag Balm. I would recommend Cetaphil or Vaseline or just something. Basically products that were not meant specifically for diabetics and for amputees using prosthetic devices all day long, okay? That is the sole purpose of VitalFit. That is the only reason for their existence, is to serve the amputee and limb loss community. These products were specifically designed for your skin. And it doesn't matter if your skin is more prone to oily and sweat, or if your skin is the dry, chapped, or if you have patches of eczema going on. This system is so well balanced that it works for so many different types of skin types. And that's really hard to find on the market, folks. Okay, so when it comes to the skin health, I start with the hygiene. It all starts there. And anybody who comes into my clinic, they get Skincare 101, along with a bunch of other 101 courses by me. But skincare is definitely a huge part of it. And I tell people, especially here, hot, sticky, humid, disgusting Florida, okay, right now, we're in the thick of it with summer. Hygiene begins with showering definitely once every 24 hours, in Florida sometimes twice a day because of just how much we sweat. And it helps with these products. So for example, the cleanser that's provided by VitalFit, it helps with the bacteria, it helps with odor, it helps with prevention of shear and friction forces within the socket itself. Okay, so it starts with that. And what I tell my patients is take the liner, and I see someone snuck out of bed. So you take the liner in the shower with you.
I'm back.
He's back.
Oh my gosh, I'm so sorry. Hang on, I'm almost there.
You there, Greg? All right.
Okay, Paul's got to let me in.
Okay, awesome.
That crashed right when you were doing introduction, Chris. I don't know if you can hear me, I hope.
We can hear you.
I went black screen and then the computer just went down. Boy.
Well, it just wouldn't be fun if we didn't have some sort of monkey wrench thrown into the situation. There you are. There's Greg.
Oh my gosh, right at the launch time. So sure enough.
That's all right. Well, you're jumping right in time, Greg, because we're starting to talk about the liner hygiene and kind of what's the importance of how we protect our skin and make it nice and healthy.
Okay, good.
So we left off with, the easiest thing to do, guys, is when you jump into the shower, take your liner in there with you. Whatever soap, whatever cleanser you use on your skin, that's what I usually recommend that people use in their liners. Because if it's safe on your skin and it's not causing a reaction, then you can probably use it on your liner as well. That being said, unless someone is really, really, really attached to their bar of Irish Spring, I usually recommend that they at least try the VitalFit cleanser, mainly because it works so nicely at killing bacteria, but it's great for people who have sensitive skin. And that's a big one. Your residual limb becomes, I tell people, the skin on your residual limb is now like the skin on your face. So you got to treat it with a lot of TLC, okay? But it's still affected at getting rid of the bacteria, getting rid of the sweat and the odor. Is there anything else you want to add to that, Greg?
Oh, yeah, I agree. I think the cleanser is pretty important, and I do agree if you've got some special soap that's in there, it'll work. But again, having the antifungal, antibacterial properties to be able to clean your liner, and if you're a suction wearer, to wash the socket out. Some people don't have liners, so again, I think that having that ability just to use one product for liner, socket, sleeve, socks, whatever that may be, just to kill that bacteria. And it's so mild because we've had other people talk about, odors to products, or they're sensitive to smell. There's no scent, there's no odor. All it's going to do is kill the bacteria and all the bad things you want to wash out. So I agree. And I always say clean is better. So.
And then the whole rinse, guys, and this is something I always, those of you who listen to my show, you know this, rinse, and then when you think you're done, you rinse it out again. What you definitely want to prevent is having any kind of soapy residue in that liner. It's going to break down the liner. It's eventually going to break down your skin. A lot of the rashes that I see coming into my clinic, these big blooming, irritating rashes, it's because people don't realize that they left some of that soapy residue inside the liner. And then once everything is said and done, along with clean, you need dry. So you need to make sure that that liner is bone dry, which is a huge reason why your prosthetists are giving you two, so that you have one that's drying while you're wearing that second one. And same thing with your skin, making sure it's nice and dry. Okay.
Yeah, absolutely. Having a spare is so important and having a spare sleeve too, because any perforation of that sleeve can create problems. But having it dry, or just make sure it's completely clear of any soap. I've heard people using Dawn dish soap on their liners and mixing that with isopropyl alcohol. It's a lot of harsh things going on that could take the integrity of the liner away. So I'd say in a pinch, I guess that's okay for a one-timer, but let's really focus on using this skincare system. So it's designed to reduce inflammation on your skin too. So that's a big one too. We always forget about. I always forget about when I wash with it. I'm reducing that inflammation too and taking away the bacteria. So that's a big one.
And then another thing about the product line, so there's the cleanser, you have a day moisturizer, a liquid to powder, and a nighttime moisturizer. And a lot of people, especially some of my male patients will go, why do I need all this stuff for my skin? I've got a cleanser, it's clean, why do I need to? And it's like, well, your skin needs balance, guys. Your skin needs balance. And part of that balance is getting the right amount of moisture. Part of that balance with the liquid to powder is making sure that it's not going to be too sweaty in the socket, okay? So I think Chris does a better job of explaining the daytime and the difference between the daytime and the nighttime moisturizers. So I'm going to let her kind of.
So we do have two options. Some of our folks, like Greg, likes to use the day moisturizer and then the liquid to powder over that. More common is for the drier days, the winter, if your skin is such that it's on the drier side, the day moisturizer is the way to go once everything's nice and clean. It has the antifungal and antibacterial properties in it. Just a nice thin layer, wait for it to dry. And to Cosi's and Greg's point, dry, dry, dry. So everything needs to be completely dry before you don the liner or the socket. The liquid to powder is awesome. It also has the antifungal, antibacterial, but it's going to go on like a lotion and it's going to dry to a thin powder, but not so much that it gums up and you've got weird balls in your liner. So once that's dry, it's going to absorb perspiration. It's also going to help with friction and shear. So if one were to decide if you're on the drier side, aren't dealing with shear and friction, the day moisturizer is the way to go. For folks that are sweating, especially in the summertime months and having some friction or shear, the liquid to powder is an excellent option.
And I will say on the side note, I treat a lot of amputees who are runners, and I will go on the training runs with my patients. And there have been so many times where we have to stop, they have to take everything out, and they're literally pouring out sweat from their liner. And I know it's a hindrance, and part of it's from Florida, but part of it is also just the nature of wearing a prosthesis. It's like, kind of like, I always use the analogy, it's like wearing a garbage bag on your leg all day long. And that can cause a lot of sweat, a lot of problems. So I know the liquid to powder has been a big game changer for a lot of my patients who are extremely active. And I know, Greg, you're an avid hiker.
That's right.
And you've mentioned how much of a game changer it has been for you to go hiking for 5 hours. Was it yesterday that you went hiking?
Yeah, yesterday was a bigger hike than that it's coming at that time of year. But yeah, I can't say enough for it because it's reducing that friction. It's antifungal, antibacterial. So that being said, you're always killing anything that could potentially be growing in the socket. And then you have this anti-friction, anti-shear property that I'm just not really getting any proximal skin breakdown since I started using the system with the liquid to powder. But the daily moisturizer too, I'm kind of caught between the two. And on my heavier days, always a heavier day is a day you're going to do activity. You're going to go run. You're going to go hiking. Maybe the liquid powder is the option for that day. But the daily moisturizer, again, we're killing bacteria and fungal little bad things that are, can occur in the socket very easily. And it's keeping your skin healthy and more integrities, because we all know, and there's 15 of attendees watching, when you have an interruption in your daily activity because you've got a little fungal infection or a little rash, it just makes everything harder. So it's very easy to use the system to take that facet out of your life. And that's when I first met Skip and Chris with the product. I was like always having skin issues, always having skin breakdown. And I think I was cleaning the socket enough, but the properties of antibacterial moisturizer it's like a game changer. And so I can't say it enough. And I always carry in my hiking pack the liquid to powder. And anytime I get a little chafing on the proximal trim line, I'll add that just to take that friction away. And it's amazing what it's done for me. I can't say enough. I'm just like over the moon with it.
Right on. So we've got a question from Raymond. Hi, Raymond. Oh my gosh, he's got the greatest tune on his phone. I did just the boogie dance. Thanks for joining. Raymond's asking, I'm constantly getting blisters, even though I am vigilant in the cleaning of my lower limb. Please assist me with my situation.
And I've got a game changer for you, Raymond, because you were one of my big raffle winners on the live event last week, which means in your raffle package, prize package that you're getting in the next few days, you're going to be getting the VitalFit skin line. So
Good.
This is going to be helping you a lot. Now, Raymond, whenever I hear someone getting blisters, The only way you can get a blister is if there's friction or shear happening within your socket. Okay, and that could be due to a couple of different things. So I'm going to throw out a couple of examples for you to think about. And I know Greg's going to be able to add on more to that. One of the things is your liner. You know, if you're wearing a liner, is it too big? Has it started to stretch out? In which case you're getting some room in there to wiggle around and move in. You shouldn't be able to, when you don your liner on, it should take a little effort. It should be kind of like ladies like putting Spanx on. It's going to take a little effort to get that liner on there. So if you have any rotation going on in there, that's potential for friction. Another thing, Raymond, if you are somebody who sweats a lot, I'm one of those people, okay? If you sweat a lot, that's also, bless you, that's also going to be causing a lot of movement in the liner, okay? And again, that shearing and friction going on. Second thing is how's your socket fitting, okay? Are you comfortable in that socket, or are you consistently feeling that one little hot spot right where that blister is forming, in which case you need to get yourself to the prosthetist to see what can be done there. But if it is regarding with sweat, if it's regarding with friction and shear, the liquid to powder lotion is going to help with that. But again, check the liner, talk to your prosthetist. And I know Greg, prosthetist right there. Am I pointing in the right direction?
Yeah, I'm over there. No, no, good points, Cosi. And I think, Raymond, that's one of the things you want to look at. Make sure your liner's not stretched out. It's not bulging anywhere on you. A couple questions I would ask is, how old's the prosthesis? How old's the liner? Do you have effort trying to get it on, or are you just slipping in the prosthesis really easily? So I think sweat could be a big one too. I'd ask you where you live. I think across the U.S. right now, it's pretty warm. So everybody's experiencing the sweat issue. Sweat will literally balloon your liner off you. It'll make your suspension inadequate in some cases. So really focus on, if you're getting this kit, use the liquid to powder, keep it clean, and see. I'd love to see a follow-up and see what you think and what's going on. But Cosi's points on donning it correctly, no air pockets in there. And then let's make sure the socket's not big, too big for you, or you've changed if you're a newer amputee or you're a marathon runner and you're getting dehydrated. So there's all kinds of facets could really be contributing to that. Or if this is a problem that you're just generally happening every day, then I would address, and let's talk about the socket fit.
David has a question. Does the day and night moisturizer have antibacterial, antifungal properties, or is it only the liquid to powder? David, they both have antibacterial and antifungal properties. So both the day moisturizer, and the liquid to powder, I'm sorry, helps if I read, the night moisturizer. And I know it's pure love in a bottle, David. So the night moisturizer is to assist your skin at night to heal. So it does not have the antifungal and the antibacterial in it, but the day moisturizer and the liquid to powder do. The night moisturizer, once your skin is clean and you're in bed or prior to bedtime, go ahead and apply it liberally on your skin. It's got emollients, humectants, antioxidants. It's going to moisturize and repair your skin while you sleep. And then again, the day and the liquid powder have the antibacterial and antifungal.
And then to add something on to Raymond's comment about the blisters, and then only because I see this a lot, the healing of the blister. And I just did a big show on this with VitalFit a couple weeks back on common skin problems, how to identify and how to take care of these problems. When it comes to blisters, guys, once you have a blister, it's kind of game over. I'm a huge proponent for getting the blister to heal as quickly as possible, especially for my diabetic population. So that means leaving the prosthesis off. And this usually does not make me very popular with my patients when I tell them this, because it's annoying. It's annoying to not be able to use your prosthesis through your day. But a lot of times people will try to put a Band-Aid on it. They'll try to put a dressing on it, and then they'll try to put the liner back on and kind of get through their day. And all that's happening is you're constantly shearing and shearing and shearing on that blister. So sometimes with folks, they try to put the liner and everything back on too soon, and that skin might be just a little too fresh and too new, and then it re-blisters again. So that might be another component to it, Raymond, especially if you notice that you keep blistering in the same spot over and over. So Could be that you're being a little aggressive with your wearing of the prosthesis while it's healing, or that there's something with the prosthesis itself that keeps causing that little hot spot.
Yeah, good point. So remember, Raymond, one more thing. I think if you use the nightly moisturizer, especially if you have any skin breakdown or any issue going on, you're healing your skin when you're sleeping. You're giving it all the nutrients it needs to when you get up in the morning to have the best integrity possible. So it's just imperative that you use the nightly moisturizer, especially with skin breakdown. And I think Cosi makes a great point. If you've got issues with your skin, if you are diabetic, you really got to keep up on this. And this is where the whole VitalFit skincare system is so important, even for that demographic of patient, is take control of your skincare, clean, moisturize, protect it at night, and you're going to have better performance. And maybe it will lead you away from these skin breakdown issues. And that's what's happened to me. And that's something you have to, you're driving, you're wearing the prosthesis daily, and you really need to focus on this, because it is, like Cosi said, it's not a fun thing when you have to spend the day out of your prosthesis. It interrupts your lifestyle. It interrupts work, daily activities, whatever that may be. It's a super inconvenience. And I'm kind of that person. If I get skin issue or a blister, I put something on it and keep going. That's just me, because prosthetics today, prosthetists generally out there are so good at what they do. We're all doing pretty good. I think that generally the population does well, but all of a sudden it's a hindrance with that breakdown. And the worst thing for me is to have to take the prosthesis off. So take care of your skin in the front side of this, and hopefully we don't, have these breakdowns and interruptions in everyday life. So that's a big one. So.
And then the follow-up, Raymond just typed in there. He says, I reside in New York. My socket and liners are extremely too large. I'm wearing 15-ply socks along with the oversized liner. So Raymond, there's your smoking gun right there, bud.
Right.
And
Exactly.
there's really, you can't bubble gum and duct tape that. That needs to be taken care of. Starting first of all with the liner. With the 15-ply sock, again, everyone is different. The textbook will tell you, right, Greg, around 15-ply, it's time to look at a new socket. Especially if you're having problems with blistering, losing your connection with the socket, like you can't feel yourself in the socket because you have so many ply on. So Raymond, it sounds like it's time to get thee to the prosthetist and get that liner replaced and talk about getting a new socket.
I agree 100%. 15 plies is a lot. So I don't know how long you've been an amputee, Raymond, but I think you need to go ahead and have that looked out. Maybe it's time to recast you and get you back down to, a couple ply, if anything. So, because that right there is probably, like Cosi said, your number one problem. It's just too big. Or eat a lot of ice cream, I don't know, start bulking back up. So.
The ice cream is a much more fun approach, I think.
That's right.
Marty had a question about the active ingredients or where to find them. Marty, if you go to VitalFitSR.com, our website, each product has the ingredient deck listed there. If you have any further questions and want me to drill down with you on specific ingredients within those decks, please feel free to email me. We're gonna pop that up at the end of the webinar, so you'll be able to get a hold of me.
Good.
All right.
All right. And all right, so we're looking good. I think it's time for a giveaway.
Perfect.
Okay, so our first giveaway is a travel kit from VitalFit. It's got 4 generous sizes of the products. So it's wonderful for trips, or if you're out for the day and need some extra liquid powder, etc. And it should last 2+ weeks or more. So to win the first starter kit, Paul's gonna put a question on the screen. The first person to answer the question correctly and put that answer in the chat box will win the prize. All righty, wow.
Wow, quick.
We got Draw McGraw here.
Yeah. Quick.
And you should win another one for how fast you're able to do that. Okay. All righty then. That is awesome. Oh, well, hello, cuteness.
Say hi, or if you're going to be here, you got to say hi.
Hi.
Well, thank you.
Good big guy.
All right. So there you are. I've got to find you. Michelle.
Michelle got it. Yeah.
Thank you, Michelle. And thank you everyone for participating. Okay. So Michelle, if you wouldn't mind emailing your address at the end, you'll see again, my email address. I'm excited to send that for you. So thank you. So now that we have a giveaway, Greg and Cosi, when you're ready, we can talk about what are the roles of your practitioner and your physical therapist.
Okay.
Well, I think we were having a great car conversation right before the show started, so we can start off with my favorite analogy. And just
Okay. All right.
the prosthetist, guys, is the one who builds you this beautiful car, and the PT is the one who teaches you how to take it into fifth gear. Basically, we teach you how to drive the car.
That's awesome.
So that's the oversimplification. So as a physical therapist, our job is to evaluate, to assess, to diagnose, and to treat gross motor function. So when I talk about gross motor function, the number one of that is gait, walking, how we move from place to place, our transfers, how we get around in our daily life with our daily function. Okay, so that can encompass a really big umbrella of things. And as you can see, probably in society today, you have so many different physical therapists with so many different specialties. So as an amputee specialist, obviously my biggest role is to help prepare the amputee from the minute they wake up from the OR, and I've done that, they're opening their eyes up and I'm like, hi, PT here, right through the point where they are running with their prosthetic devices and everything in between, okay, helping people get their mobility back, their strength, their range of motion, balance, proprioception, coordination. And probably one of the most important things that I do is working with folks like Greg. I hope I'm pointing in the right direction. I don't know if our screens are different, but working with the prosthetist. I cannot do my job if they haven't done their job. And it's so important to have that communication available.
No, I agree. Cosi, you have it spot on. The ideal situation is you have a prosthetist who has a PT like Cosi on staff, or have the availability of that PT that understands our directive, how we, after we evaluate as a practitioner, we evaluate what the patient is, what they're gonna do, what their lifestyle is, what their goals are. And that's probably one of the biggest ones. I'm very goal oriented, and I like to listen to what patients wanna do. And then we select what's gonna be the most optimum componentry that will enable them to do all these things. So that's kind of how I approach it. I like to talk to the family and get, there's a lot of patients will be, I'm going to go run a marathon, and the spouse will go, well, he ran, 600 yards 5 years ago. So, but I love to, integrate the family into the fitting process. And, we're all a team here. And I think that's the points that Cosi's making. We have to work as a team, as a practitioner, PT, family members. And that really results into the best outcome for the user. The second role for a prosthetist is casting and setting up and aligning and make sure that's, that socket is perfect. And I hope that everybody out there today who's attending tonight has a prosthetist that actually listens to your needs, your goals, evaluates, allows you to try different componentry. I think a lot of people, what the best thing today is, with the World Wide Web, we can look at all these different feet, all these different knees, and let the patient try them. That's the coolest thing that I like to do, is say, well, let's try this fit. Well, I read about that fit. Okay, let's try that fit. Because there's no big deal other than, every fit's got a 60-day trial. Every knee has a, 30 to 60-day trial today. So it's imperative to make sure the practitioner is not just putting on a component out there that they know they have success with everybody. Is allowing the patient to have input and having your practitioner listen. So I'm really big about that. And then the whole clinical coaching, how to use it. We initially set up program, whatever that may be, make sure we're aligned and teach that patient the first steps, but then having a Cosi involved is so beneficial to the outcome. Because once you go out of the shop, then sometimes you're on your own. And how many patients I've encountered out there that their alignment may be a little bit off, or their foot choice was, one category too stiff. So to have limb loss specific PT is golden for you, because Cosi can identify these things. And I always used to joke about like Monday builds, you know, or it was at a Friday build when I see people with a, you know, not optimum alignment, or maybe a knee that may be a little too much for them, or a foot that's too stiff. I encountered that a lot. So having a second set of eyes is just, it makes it easier on me. So, but I mean, those are the two different things we do. You know, we initially build, and then Cosi would, or the PT would teach you how to negotiate everything that you encounter daily, that being stairs, ramps, the mall, even though we've got a lockdown, or hiking, or cycling, or rollerblading, or running, whatever that may be. You have to have somebody to teach you, and that's where the PT comes in. It's so critical in the rehab process. So.
Absolutely. And Greg touched upon a lot of great points, and it actually brought to mind a conversation I had just last week with two different prosthetists in my area. And with one prosthetist, my patient was being reevaluated for a new foot. And I've been working with this patient now for 4 weeks. So I know exactly, not pinpoint the foot, but I know his foot needs to be something that connects him to the ground. It needs to be able to handle his hunting and everything that he likes to do, and going out on a boat, and it has to be waterproof. So in my mind, I'm thinking, okay, he needs some sort of like hydraulic foot ankle system. And I also want him to compare it to something like the Soleus from College Park. And I had a couple of different feet that I really was excited for him to trial. And unfortunately, when I spoke to the prosthetist, they were just like, no, we only like to use this one foot. And then I compare that to another conversation I had with a different prosthetist, and a very similar conversation. And the prosthetist's answer was, okay, I'm going to call the rep from this company, that company, and that company, and we're going to have them give us a couple different trial feet so that the patient can try these different things.
That's what you want. That optimizes the outcome. And that's, right. I agree, that's how it should be. Again, I have encountered, and I don't think it's as much anymore, but in the past, I have encountered guys that this foot A, whatever that may be, works great for everybody. And that everybody is different. And that's what I try to like encourage, like, listen, let's try something. The double-edged sword to that is when somebody goes online and they go, ooh, I need that running foot for every day, you know. I'm like, well, I try to say maybe that's not the best foot for just general ambulation around town and around your house or whatever that is. You know, educate yourself as a user. Make sure your PT understands the latest technology, your prosthetist understands. Today, most prosthetists are up on education. They're up on technology. But I did hear something new today with the magnetic liner for donning. I never heard that. So if they're, you know, we all learn every day, but in a perfect scenario, your prosthetist is there to see you get back to a normal active lifestyle, whatever that may be, and your PT is following right next to him. You know, we're all holding hands here, and you're driving the prostheses kind of theory. And let's just make sure it's right. So get a good team. That's what I'm going to keep reverting back to. But again, if the socket, if I've cached you, set you up, everything looks great, alignment's good, Cosi teaches you how to run, negotiate that staircase, because stairs can be a problem for even a seasoned user. The biggest thing that people do not pay attention to is their skin care and their skin integrity. So back to the simplest part of this equation is take care of your skin, use the VitalFit system, and you'll excel.
Absolutely.
Sound like throw something else in there, but I think that's really something that's been overlooked for so long that we don't overlook now.
Yep. Yep. So let's do a quick, I love doing the Cosi polls, guys. You guys know who've watched my show. I do way too many of those. How many of you guys have had problems with your skin? Either a blister or, help me out here, folliculitis, heat rash, fungal infection, yeast infection. How many of you have experienced something like this in your life as an amputee? And then if you can additionally put in there, how many of you have had a clinician who's spoken to you about this, on how to take care of your skin? And guys, I'll be the first one to be tough on my own profession. There's a lot of PTs that don't take the time. And that's something that whenever I have a PT student in my clinic, or I'm coaching someone, that I tell them they need to look at their patient's skin, especially of the foot that is still there, making sure we keep that skin healthy making sure we are educating. So we've got pressure sores.
Great.
Yeah, we've got some people chiming in here.
Great.
Okay. Educating my patient on how to take care of their skin, how to ease into wearing a socket, not just to put it on that first day for 5 or 6 hours at a time, allowing their skin to get used to it. So yep, Tom says his prosthetist helped with a major infection issue. Good.
Hey, Tom, how you doing, by the way?
AK.
Good to see you.
Ashley says, yes, my PM&R, PT, and prosthetist.
Good.
And that's exactly
Perfect.
what it should be, guys. That's exactly what it should be. It should be the entire team, from the PM&R doc to the prosthetist to the physical therapist.
Right.
And so many times, you know, Greg joked around about, you know, the Monday fit or the Friday fit. It goes for physical therapy too, guys. There are times where I may not see a patient for a little bit of time, or I haven't had time to work on something with them, and the prosthetist will call me and say, hey, this person's core strength, we really need to get this thing going, okay? And having that team approach there, having that team approach. Many times I get asked the question, how do I look for that PT or prosthetist? So I know I have my key things, and I know Greg has his key things. I tell people, go interview them. The PT and the prosthetist are two people that are going to be a part of your life for a really, really long time.
Right.
So you need to have a good relationship. And sometimes that means you might need to look a couple of different times, and not just because of the person's clinical skills, but also on their personality. What's going to fit well? Are they going to listen to you? Okay. And this is something that I tell them, you know, schedule that interview. If your physical therapist or prosthetist can't give you 5 minutes on the phone, return your phone call within 24 to 48 hours. That's already a good indication to you right there that they may not be the best clinician for you if they can't get back to you and give you 5 minutes of their time to answer a couple of simple questions.
No, I agree. I agree with Cosi on that. My cell phone's on all the time, you know, and you should be able to get in touch with your prosthetist, because the worst case scenario is something comes loose or something breaks, and then, you know, we're interrupted in our daily activities. So make sure they respond. I think Cosi has a perfect interview. Talk to people. See what your amputee support groups think of people. I think it's all, this is, again, you're back to, you're the user. Let's optimize it, find the right person, the right personality, and keep on. I think Ashley has a great scenario here with PM&R and PT and process. I see another one up, and Chris, the guy had skin problems that the prosthetist never really educated from my prosthetist on issues. I'm reading that. Sorry. That's a shame, because there's clinical coaching, and it's part of my job is to educate you how to use it too, how the function is, the simplest things if you're using a microprocessor knee, the charting scenario, how to look at your steps, things like that. This is all part of the process that we should be 100% engaged in. Your prosthetist and PT should be right on par, because this is your life that you're living. And there shouldn't be interruptions here because you're not being told. So again, I'll go back. I think prosthetists in this country today, in this day and age, are doing very well as a general group. We're not talking 20 years ago anymore. So good on you on that one. I did see a pop-up about a ski knee here. Best legs for Alpine skiing. From Carissa. So depending if you're using, if he was unable to. So Trans-Femoral Amputees, there's a couple different choices out there. Again, if your socket and your skin integrity is no good, to start, it makes it very difficult, but there's some, you know, Bartlett knees, there's the Moto knee from Moto Mike. Autobach has the ProCarve if you're using a transfemoral type of system. When it comes to ski feet, that's all upon the user's choice. I have some friends that we've set up some of the ski feet that are specific for going into the binding, which people love because it reduces the weight of having a ski boot. I personally like to set guys up with ski boots because IPC rule, if you ever want to be a Paralympic ski racer, it requires you to wear the ski boots. Those ski feet are on the blacklist today. So we want to be like our peers. So I say use the boots. If you have got suspension issues or real short residual limb, and that weight is a critical factor, then we can ditch the boot and we can go with some of these ski specific feet. But so answering that question, there's some great products, but the optimum scenario is having your ski specific prosthesis, just like it may be your water specific or your running specific. So in a perfect world, we have all these. So.
Okay.
And I want to say thank you to David, who I met at the Amputee Coalition, and things have been going well since we talked about the importance of taking care of your skin. So thank you, David, for reaching out. I appreciate that very much.
Oh, that's great. That's a great one, Chris. Yeah. So I think, David, if I can reiterate that, you now understand the importance of skin care, skin integrity, and your daily outcome is better. So that's awesome. That's why we're here. We're here to help. As a professional prosthetist and a professional PT, I know that Cosi will agree that you have to look after your skin. You have to look after your liners, and to get the most optimum outcome daily, it's this simple little thing. And David here points it out. So good job, Chris. I like that. That's good.
And we've got Mark here who said recently trialed the skincare line thanks to Paula. Great, good line. Okay. Paula has, I think this, whoops.
Paula
Mark,
had a good recommendation from Paula. It's awesome. We're getting lots of input. Thank you guys so much, and gals. And Paula mentioned if you are using an old liner, it is good to soak your liner for a few minutes with VitalFit, then rinse, rinse, rinse.
Mm-hmm.
God love you. Thank you, Paula.
Yep. Good. That's a way to do it.
all right.
Mark there with the liquid powder has been amazing for reducing shear issues. It works great. And then Mark here's another patient that identifies how great that product is. I like to share my little horror story, and I haven't sent them to Cosi yet, but I sent to Chris and Skip some pretty bad blisters that I created on my own self, just by not addressing the tingling little pain and going on and on. But I'm not experiencing that anymore since I've started with the skincare system. So as a prosthetist, I recommend it. As a user, I'm going to tell you, don't live without it. It just has really changed my life. Surprisingly, the simplest little thing is what I keep thinking, reiterating my own mind. So,
yeah. And then just to kind of add as a final, just an extra note to that is for those of you out there who have diabetes, vascular issues, and that if that was the reason why you lost your limb in the first place, then especially for you, this product line is wonderful because it's not only taking care of the residual limb, but it's also taking care of the skin on the other limb that you are now having to protect now more than ever. So you've heard me say it probably more than once. The diabetes and the vascular issues did not get amputated with your limb. They are still present in your body and trying to cause trouble. So along with medical management, treating it from the inside between managing your diabetes, whatever medications you might be taking that your doctor prescribes to you, you also have to manage it from the outside. So my diabetics out there who have that brawny looking skin, little red, little scaly, kind of dry skin on the bottom part of their leg, this is the part that you need to get on with this particular skincare line to help keep that skin nice and healthy. And I myself, I'm not an amputee, but I use this stuff because it's really great. So you can use it on your body everywhere. So it's wonderful in that regard.
That's a huge point that I always kind of overlook and the things I don't think about, but how many times I've had patients with diabetic issues and not optimum skin on their residual limb or their existing limb, they bang their legs together with the prostheses. And that little cut can grow into something serious. So let's really focus on keeping that sound side healthy. So that's a good point, Cosi. I always forget about that, but I've seen that happen a lot of times. So okay. I see a pop up from Mark here saying I'm a quad amputee, suggesting any suggestions for upper limbs that might differ from lower limbs. The skincare is the same. So I really believe that there shouldn't be a difference there. I mean, we don't want to use a prosthetic fit on for a hand that I'm joking. That's supposed to be funny. That it's not that funny. But yeah, skincare for your socket, depending on what kind of suspension you're using for your upper extremity system, just keep it clean, rinse it out, moisturize your skin, and you're going to even have better performance too there. So
wonderful. So I think it's time for another giveaway. If everyone thinks that's a great idea. Another travel kit size. Paul Sewell is going to, in the chat box, put our website for VitalFit.
We'll play.
Hey, Paul, are going to do that for. There it is. Thank you, Jamie. Please go to the site, our homepage, and come back and put in the chat box where the VitalFit products are made. And we'll give you a seconds to do that. And the first person that comes back with the answer is going to receive a fabulous travel size.
Perfect. I'll give a little hint, Get it? I see one answer.
California, we are located in California. Thank you, Paula. Our warehouse is in SoCal and our corporate offices are in San Diego.
Mark's got La Mesa put up there.
That is the address of our corporate headquarters. Thank you, Mark. And I think it was Mark. I'm so happy your limb isn't falling off anymore, Mark. That's we were caught by surprise of having leg fall off. I hope you're okay, and that the liquid to powder is helping with that.
I didn't read that one.
Yeah.
Caught by surprise having a leg fall off. Oh boy. Yeah, that's good, Mark.
We're gonna go with. Should we go with? What are we gonna go? Sorry.
La Mesa, David put up.
All right, we're gonna go with La Mesa, California. It is in the beautiful US of A. And
I was kind of doing the little, okay, there's it was a hit.
La Mesa and California are in the United States of America. And so, Mark, we're gonna go with you and thank you so much. Congratulations on that.
Congrats.
Awesome. So I have a question for the group. How many folks are fortunate to be able to work with a prosthetist as well as a physical therapist? I'm curious because the Cosis of the world are a bit of a unicorn, and I'm hoping that will change, and I know everyone else is too. Just curious.
We're working on it. And that's one thing, guys, I do want to say, unfortunately, we are unicorns. I don't consider that to be a badge of honor. I think there should be more of us out there practicing this. But one thing I do tell folks is if you find a physical therapist that you have a good relationship with and they are motivated to help you, our training as PTs, we already have a lot of that knowledge that we need. And a lot of PTs don't even realize this. We receive so much training on gait training. So anybody who's ever taught a person with a stroke to walk, with a traumatic brain injury, with a spinal cord injury, with burn injuries, with cancer-related issues, teaching them how to walk again, okay? They will have the skills that they need to teach you how to walk. In fact, a lot of my own treatment techniques come from my experience of working with all those different populations. And this is where the prosthetist can really be such a huge help. Because if the physical therapist is motivated and they're in communication with your prosthetist, you can have a really good outcome. A lot of it is for the physical therapist is to learn the basics of componentry. Me, I'm a nerd, so I love learning really the nuts and bolts of componentry with prosthesis. But even if I knew just the basic bare minimum of prosthetic devices, my gait training knowledge, that's what my patients benefit from. Okay. And everything I've learned in my career has been from working with prosthetists and just asking them questions about, okay, mechanical versus computerized knee. What are the key points I need to look for here? Or the Rio versus the Genium. And I still have to ask questions about the differences. And that's where I pick up the phone and I call the prosthetist. So if you have that physical therapist who's got that interest and wants to help you, this is a great suggestion that you can make, and you can kind of help facilitate that connection with the prosthetist. So just something to put in the back of your head. I've had a couple of viewers that they had really good success with this.
Oh, that's good. Yeah. That's a great analogy. And that's what it should be. The patient, again, I always go back to you're driving this bus, you're wearing the prostheses, talk to your PT, talk to your prosthetist, make sure they're communicating. Make sure your PT understands. I don't really think and I can truthfully say, I haven't met any PTs that weren't wholeheartedly wanting to see the patient do better. If they were limb loss specific or not, it didn't really matter. I think they're all really motivated to see prosthetic wear or do well. So I think those, the unicorn comment is a good comment, and I think, you know, Cosi is a unicorn, but I think that I've been pretty lucky in my years in this, seeing that cohesive teamwork with PTs out there. So it's great. And I'm reading some pop-ups, and I see Tom putting up there. He's had great. Sorry,
You
never
met
met a PT who knew anything about amputees. So I know you, Tom, and I've known Tom for a long time, and that's kind of alarming to me how well you do. So maybe you're a self-taught guy. So I think that's great, Tom, but that's a shame. I see that it is frustrating, but there's, you know, the saying, build it and they will come. You can always go to Florida. That lady over there. So, and I think you can talk to her. If you call her up or suggest, I know she's busy, but she'll take the time to help you with somebody in your area potentially, or spend a week in Florida on vacation and learning how to run in the sand. So I think that's one of the things that Cosi brings to the table that I'm super impressed with as a practitioner.
Thank you. And then guys, I will put it out there, and I am sincere in this offer. I've had several PTs from around the United States give me a call saying, someone said they were watching a show that you did and that you know about amputees. Can you, and I will do video consults and just help the PT kind of get the ball rolling. There should be as many PTs doing this as prosthetists. There's no reason for it. And you know what, Carissa brought up another good point that I do also like to address. She says she did physical therapy prior, but the insurance doesn't cover now. So guys, I'll just lay it out there for you. In my own practice, I don't accept insurance. And this is one of the reasons why, is because insurance, unfortunately, will cut us off before we're even halfway done with treatments. And a lot of times with insurance-based practices, you're being seen with several other patients. It's a messed up system. I'm not going to lie. And there's no solution for it now. I can't say that there is. There's little loopholes that we can take. And one of those is sometimes finding that physical therapist who does out of network practice where they're giving you that one-on-one care. It's an investment in your health. And that's what I kind of sometimes see. And I also see all those co-pays that you've been paying with your insurance-based practices that aren't getting you anywhere. You can apply it for your private practice, private care physical therapist. So that's something else to kind of think outside the box sometimes. And a lot of people sometimes are a little scared to go out of network for their clinical care. But if it can get you to that next level in your mobility and in your quality of life, to me, it's totally worth an investment. So
that's exactly right. That's the everybody listening and attending. That's exactly what Cosi said. This is even if the insurance doesn't pay, it's an investment in your rehab, and you're going to do and benefit from it. So it should be no question, and I understand that. I'm reading some more of the pop-ups. I see that Raymond had great therapists, but not such a good prosthetist. It can happen. I've seen some less than outstanding builds out there in what I do today, and that's unfortunate, but there's somebody else who will probably address it and take a look and evaluate you. So look around, find somebody who will listen. So I'm reading a few more that Paula puts in there. My husband has cancer and having skin issues, and the day and night moisture is helping. So that's awesome. It's exactly why we're here. We're here to help. We want to see people excel, and it all starts with the skincare.
And then Tom, you're from San Antonio, Texas. I lived in San Antonio for so many years, one of my favorite cities in the United States. And actually, Tom, I just connected with a physical therapist amputee specialist I forget if I think she's in Houston or Dallas. And I know that's not near San Antonio, but at least it's in the same state. So if you're interested in her name, she's an amazing physical therapist. Her name is Alicia White. So dedicated to the profession, knows her stuff. She trained at the Center for the Intrepid. So I was just so happy to connect with another PT out there who was so well qualified, Tom. So if that's something, again, just to have in your Rolodex, and I'm showing my age now by saying Rolodex, just to have that name, it's a lot closer to you than Florida. So I'd be happy to give you her information after the show is over.
That's good. Awesome. I see Ashley, your prosthetist was a PT and then went on to become a prosthetist. Awesome. Nice work. That's a good person to be with.
That's a great combo right there.
Yep, it sure is. I see Tom Stokes S going on 19 months walking. So congratulations. Nice. This is a ongoing process that with the prosthesis, you're going to, the rest of your life, just focusing on excelling and setting goals and looking at your step counter and bettering yourself, taking care of your skin. So good job at 19 months.
Yep.
I see Tom's going to be in Tampa. So Tom,
I saw that. I was like, okay.
You got to look her up.
Come by and say hello.
Yeah, no, Tom's a great walker, Cosi. When you see him, he does very, very well.
Awesome. So Marty asked, how many therapists work for me? Me, myself, and I, Marty. Just a little background. I have 4 beautiful children. So my primary job is mom. And I opened up my private practice basically because all I wanted to do was treat amputees. That's it. That's all I wanted to do. I'd been practicing for 15 years, working in every other kind of setting, treating all sorts of patients. And this is what I wanted my focus to be. So my practice is very small, basically, because like I said, I want to make sure I can keep running it and keep it sustainable. So it's pretty simple, just me. And I spend one-on-one with all of my patients. And I have a small caseload so that I can really just dedicate to each patient the time that they need. So fortunately, I haven't had to put anybody on a waiting list since I opened. So I've been able to kind of manage that so far.
Awesome. I'm reading Kay's working our way down to see you, Cosi. So I like that. That's good. Good luck. Kay, you'll do well. David, you're welcome. That's why we're here, to see people do well. That's all what's so interesting to me as a user of prostheses and a prosthetist, I just want to see people excel. So good. That's good to read. And Tom, yeah, I got your text. I'll call you tomorrow. And yeah, you need to go say hello to Cosi when you're in.
I would love to meet. I'd love to meet some of my viewers that I've seen the names for on so many different shows. I'd love to meet in person.
Awesome. Okay, I'm going to take just a break. We're towards the end for this fabulous 4-part kit of the VitalFit full-size products. We are going to put a link in the chat box, folks. And once you click on that, please fill out the survey and we will get the survey responses and we're gonna draw names. So Paul Sewell and I are gonna do a little hat trick here. So give a few minutes for people to fill that out. You'll see it on the right-hand side. Click on it, fill that out. And we'll give Greg and Cosi a little bit of a break. And for those, once you get it finished, folks, if you want to throw some more Q&As in there, that would be great.
Yeah, throw them out here, you guys. You got us right now online here, so ask them. Got a great PT amp from Marty. Specialist, good. Yeah. Keep investigating who these the PTs are in your area. Call Cosi. She'll recommend somebody if you can't get to Florida. I would do the same. If you're looking for a process, you can get me through VitalFit. I'll return the call. If you're looking for high-end sports prostheses, I know tons of people, and I'm more than happy to refer you to anybody. And then I follow up with them and make sure they're doing a good job. So I'm all about that. So
actually, Greg, that reminds me, I do need to ask you for a recommendation for a running prosthetist. I do need that.
Okay. In Florida?
Yeah, somebody who really knows how to align a running blade well. I'm kind of tapped out at my scope of knowledge there. I can teach the person how to run with it, but the alignment part is the part where I'm still like, yeah, I need someone who really can fine tune.
Okay, local to you? In your area?
Preferably.
Okay, good. I've got some people. We'll talk. For sure.
I didn't think of that before. I'm like, why didn't I ask her?
Yeah, there's a lot of people around you that are good. So I can, but we'll talk. We'll talk tomorrow. How's that sound?
That sounds good. That sounds good.
Any more questions out there, people? Let's throw some out. It's good to see everybody on here.
Yeah. It's interesting, Tom. I was actually, so we're taking a badly needed vacation, and we had 2 vacations canceled because of COVID. And actually, I was trying to get out to San Antonio, and I was like, nope, San Antonio's all locked down, shut down. They don't want anybody from Florida.
So,
Oh, I love San Antonio. Love San Antonio.
Done a lot of shopping in San Antonio. I just remember that. So the Riverwalk, that's San Antonio.
Riverwalk, right? I always did a lot of eating when I was there.
Yes.
The restaurant, the restaurant, the restaurant.
I ate so much when we went to the coalition conference. And then did you guys make it to the market, Mercado?
I don't think I did. No.
That's like, it was like about a mile away. And you walk past the Alamo and you go to the Mercado and it's all like the street vendor food. So it's like,
Wow. My favorite.
yeah, I basically ate my way through San Antonio. That was wonderful.
All right. The surveys are coming in and I'm just waiting for Paul to let me know who he's picked out of the hat. And while we're waiting for that, I just want to mention, we're going to drop the screen at the end. It's got our Facebook, our Instagram, website. And I wanted to let everybody know that we're really excited about this educational webinar series that we're doing with Cosi and Greg. So we will be posting, because we're taping them on Facebook as well as YouTube Live and on the website. So if you'd like to share this with a friend, please let them know that they can watch after the fact. And the winner is Ashley.
Ashley.
Oh, Ashley.
Congratulations.
So congratulations, Ashley. Please send me your address and I will send you the 4-part full-size kit. So,
Awesome.
right. And if there aren't any more questions, thank you. You're looking forward to the next one already. Thank you so much, Tom. Okay. So Paul's going to put the last slide up while we can still see Greg's beautiful face. Oh, we can't. And Cosi, there you are. So here we go. The VitalFit website is there. And again, please visit on Facebook as well as Instagram. And we're on YouTube as well. So everyone be well. And again, thank you so much, Cosi, Greg, and all your support leaders. Thank you so much.
Thanks, everybody. Thanks for having us. Thanks for
Guys,
coming. Thank you, Chris.
Take care.
Okay, see you. Good night, everyone.